A common theme in populations that spend much of their time sitting is pain on the front of their hip, okay? Generally anterior hip pain. Now, that is caused when our hip flexors, i.e. the musculature on the front of our thigh, start to tighten up. When they tighten up, that in itself doesn't feel good, but then we can also get some malalignment of the hip joint itself. So, for this sequence, we're going to talk about using foam rolling to get some of those hip flexors to turn off, calm down a little bit, and then use a joint repositioning technique to make sure that the ball and socket joint that is our hip is in a better alignment so we're not getting pain in the joint itself. The tool used to address our hip flexor with targeted pressure release is going to be our ulti roller. So what that's going to look like, we'll have a roller on the ground. We're going to have one leg extended, that'll be the leg that we're rolling. And really, we're going to be anywhere on the front of this thigh. Our hip flexor kind of runs all the way down to our knee. So what that's going to look like is we will start up by the pointy part of our hip. We're going to go find the problem tissue where it's a little bit more sensitive. So I'm rolling through, and right about there, it's a little bit more tender than the rest of my quad, and so that tells me I'm in the right place. So we're going to sit on that pressure, make sure we're relaxed, that we're not bracing against the roller at all. And once we have that relaxation, that breathing, then we will go into our contract relax. For our quad, the way we're going to contract is by extending our knee on the side we're rolling. So in this case, left side, extend my knee. I'm going to squeeze my quad for 5 seconds. 5, 4, 3, 2, 1. And then we will relax, bend that knee, make sure that quad's nice and loose, let that pressure dissipate into it. After 3 rounds of that contract relax, then we can either stay on the same spot or we can continue rolling the entirety of our quad, look for other trigger points, other tender areas that might be causing some issues. Now, once we get some good time with that targeted pressure release, 5 to 10 minutes, just addressing the entirety of that quad, then we will move into a little combination stretch/joint repositioning technique to introduce some further lengthening into that quad, as well as help our hip joint regain a better position. With this technique, we're going to get 2 birds with 1 stone by stretching our hip flexor, but then also introducing a band within that stretch to help reposition our joints. So we're getting the muscular benefit of lengthening the hip flexor, then we're also going to help our femoral head regain a better position within our hip socket. So what that's going to look like, as always, first off, when we're using the band, let's make sure it's anchored to something firm. I don't want you to get slapped in the face. I've done that a billion times. Now, what we're going to do is on the leg we just rolled, so I just rolled out my left hip flexor, I'm going to put that leg through the band. Once that leg's through the band, I am going to get my knee on the ground, and I want the band to be as high up on our thigh without actually going over our glute. Okay, so essentially as high up on our femur as possible without that band going over our pelvis. So, it's all the way up at the top of my leg, and then the final step is going to be getting some tension in the band, so stepping or getting back from that anchor point a little bit. We'll bring our opposite leg up, and then all we're going to do is find our end range. The way we're going to find our end range is we're going to keep our knee on the ground and let that band pull our pelvis forward. You should feel a stretch right here on the front of your hip. And let's make sure that we're getting this stretch, like I said, from the hip and not from our low back. So I want to see that our ribs are stacked over our pelvis and that we're not just flopping into it and stretching our low back as opposed to actually getting that femur behind us. Now, once we're at that end range, contract, relax cycles, you know the drill. The way we're going to contract is I'm going to push my knee forward into the ground. As always, it's a static contraction, so I'm pushing my knee forward through the ground. I'm going to hold that for 5 seconds, 5, 4, 3, 2, 1, and then when we relax, we'll see if we can get that band to pull us further into that range of motion. At least 3 rounds of that contract, relax, but honestly, this is one of the better stretches that we can do for our hips and one of the better joint repositioning techniques that we can do to alleviate pain. So if you want to spend 5-10 minutes in this stretch, be my guest. It's a good thing. Give that anterior hip pain mobility sequence a couple days. Give it a try. Let us know how it helps with your hip pain. And if you have any questions, comments, or concerns, please reach out. I'm always here to help.